All right, awesome. Charlie, we're back, obviously talking more about airline benefits. We're going to get into health insurance now. Obviously, very confusing. I guess, how do I decide which plan is right for me?
That's a great starting point, Ben, because, as you're a new hire, when you're a new hire in the airlines, you're sitting there doing these briefings for hours, and it's like Chinese, I don't understand any of this stuff.
Yeah.
I remember that feeling. And then every year we have open enrollment, so we can change, our health benefits.
Yeah.
And lots of other benefits as well during open enrollment. But the first thing you need to think about is, what's the health of your family? Do you have chronic health problems? Do you have a lot of ongoing needs for medications? Maybe special needs children? Those things are going to drive what types of insurance you have. For example, for me, if I've got a lot of health needs ongoing, predictable, then I'm going to probably choose a lower deductible plan, which usually leads to the more expensive type plans. But that's okay because I'm using it all the time. In the long run, that can save me. That's just one example. Now, there's no set laws or rules that say we have to do that, but that's kind of a generalization. The other side of that coin, Ben, is that if our family is relatively healthy and we have some money aside, we have an emergency fund aside so we can pay for some out-of-pocket expenses, then I might go and choose a higher deductible plan, which is sometimes called the health savings plan. Now, that's not, again, a hard and fast rule. I've seen people with a lot of medical needs do a high deductible plan.
Yeah.
That's okay. Yeah. But that may be a good starting point.
Okay. There's the health savings plan.
Yeah.
When would I need that?
Yeah.
Do I need that?
Absolutely. I love the health savings plan. I'll just throw that out there.
Okay.
It's not right for everybody because, again, the first point is know your health needs as a family. But if you're relatively healthy and you've got some money aside, you could pay $100 if your kid goes to the 24-hour clinic because of the flu. If you can't do that stuff, don't do the health savings plan.
Okay.
Because you got some out-of-pocket expenses.
Yeah.
But I love the health savings plan because it allows me to save. I think this year the limit changes, kind of like an IRA. It allows me to set aside $7,000 a year. I think the limit is this year, depending on whether you're married or single. And Ben, that's tax deductible to me.
Wow.
So let's pretend that somebody's in the 32% tax bracket. We got to do math again. What is that? About $2,000 in tax savings a year.
Yeah.
I love it. So right off the bat, at the beginning of the year, I'm ahead $2,000. And some of the airlines out there, I've seen where Delta and FedEx and even Southwest will pay some of the money. Like Southwest will put $750 into an account per year in the health savings account.
Oh, wow.
For a family, that's a family. I think it's $400, $450 for a single. So that's nice. That pays all your premiums. Your premiums are much, much lower, maybe around the range of $20 to $30 a month for a family. So essentially your premium is taken care of. You get to put pre-tax money in there, saves me on taxes. Now, again, if I go out and break my ankle, I'm going to pay some out-of-pocket expenses. In fact, I could pay up to $3,000, I think, depending on your plan, before insurance pays anything. Okay. And then I'm going to share costs with the insurance. 80%, insurance, 20% me, until I get to, the out-of-pocket maximums can be $7,000 for a single injury, or if there are two people in a family were injured at the same time, you could have an out-of-pocket maximum of $12,000. So that's the downside of it. Okay. You know what? And that might happen, but you are going, after the first year or two, you're going to have that much saved up and more in your health savings account to take care of those.
So you can use it in those scenarios as kind of a last resort to draw your money from as an emergency kind of fund for those types of scenarios.
Like right now, even if multiple members of our family had accidents and we had the maximum out-of-pocket expenses, I've been saving the health savings account for several years, so it's covered. Okay. I don't have to worry about that. Yeah. And I love the health savings account because once I turn 65, Ben, I'm going to have a lot saved up in that account. I can use it for whatever I want. Okay. Now, I got to pay taxes on it. If I go buy a new car at age 65 with my health savings account, I got to pay taxes, but not penalties. Okay. Now, if I use it for non-healthcare expenses prior to age 65, I'm going to have to pay a penalty and taxes. So don't do that. Yeah, yeah. And really the reason why this is such a popular option is because it essentially turns into a healthcare 401k. Okay. What I do personally, Ben, is if I take my daughter to the clinic and it's $100, I pay it out of pocket, I leave my health savings account alone. because I really want that account to pay for retirement healthcare expenses. Because in retirement, my two biggest expenses will probably be healthcare and taxes.
Yeah.
And this one helps me on both because I can pay long-term care premiums tax-free, any kind of medical expenses tax-free. And so that's what I'm preparing for.
Wow. All right. So there's a lot of flexibility, obviously, with it.
I love it, yeah. It's not for everybody. You know, some people, it kind of scares them a little bit. I understand that and know the details. We're not covering all the details here, but get in the details before you make the choice.
But you love it.
I love it.
So another quick point on that is in healthcare is a lot of airline pilots, obviously former military. Yeah. They might have things like TRICARE, or how should I consider my plan if I do have something like TRICARE?
Yep, absolutely. So if I'm an active duty retiree, I did 20 years, I got my pension, and I'm on TRICARE, I cannot do the health savings plan, first of all.
Okay.
Because I've got TRICARE. But that's okay. I've got TRICARE. That's awesome. So now your choices are kind of based on, I think, where you live. For example, we have a family that lives in the Milwaukee area, and they're retired military. They have TRICARE. But they also have chosen to do, at Southwest anyway, what's called a regular plan. And it's kind of a grandfathered healthcare plan pre-ACA days, Obama healthcare, as some of us know. So it marries up really well with the regular plan. At other airlines, it could be also called something different, but it blends very well. The reason why I say location is important is because they don't have access to a lot of military bases nearby in their area. So they can't just go to the military base hospital. They got to go to a regular hospital.
Yeah.
So that dictates what benefits. Now, another family lives near Annapolis, Maryland. They don't need anything besides TRICARE.
Wow.
Because all the military benefits, the facilities are there. TRICARE is just fine. They don't do any insurance. And they're Southwest people too. They don't do any insurance at Southwest Airlines. And I think Southwest pays them, $50 a month since they're not doing any health care.
Wow.
So that's, two different things there to think about.
Not to get too down in the weeds, but anything else that we can consider with
I think one of the things that you got to be careful of, and this may be Southwest specific, but a lot of people like the regular plan. It's fine. It's a good healthcare plan, very low deductible. I think it's free.
Okay.
It's pretty nice.
Yeah, that sounds great.
But the problem, one thing to watch out for, free is good.
Yeah.
One thing to watch out for, though, is that you lose your life insurance through the group plan.
Okay.
So a lot of times, let's say I got $1 million life insurance through Southwest Airlines. That's what I need. That's what's right for me, possibly. And then I'm like, hey, I want to go to the regular plan. Okay, I get the regular plan. I save a lot of money on premiums. But all of a sudden, my life insurance now is gone through Southwest. It's down. The maximum you can get is $100,000 on the regular plan.
Wow.
So now I got to go, okay, I got to go out and buy some non-Southwest life insurance, because $100,000 of life insurance is not enough for any airline pilot.
Yeah.
Just, I can almost generalize that for sure. So that's one thing to watch out for, and the other thing to think about too is what happens if I become disabled at my airline. What kind of health insurance am I going to have available to me?
Yeah.
So you're going to have, there's a lot of moving parts there. So look into that. COBRA is going to kick in. Some unions at the airlines will reimburse for COBRA. COBRA is expensive. So it's something to think about.
Yeah. Well, great. Obviously, a ton to think about.
Yeah.
It's very important, obviously, to have a really good plan in place and think about these health insurance questions. Thank you, obviously, for listening. We'll be back with more information coming up.
Thank you.